Dr. Pelto, and today I want to talk about a condition called Sever's disease. I had a young boy in my office this week. He is 13 years old, and he just started out his soccer season this year in the last 2 months. He had been suffering from heel pain, causing him to walk on his toes and limp, and he came to the office with his dad. As we talked, I found out he saw a colleague of mine 2 years ago for heel pain. And there were worries at that time he had a stress fracture. Now the pain is back. Now first we have to remember that kids, they rarely get stress fractures unless they jump up and down or from a high surface. Now let me show you his x-ray. You can see that there is a wiggly line at the heel region, and this is called a growth plate on the heel. Growth plates commonly bother children who are boys between the age ranges of 10 and 15 years old, and for girls it's a little bit earlier. It is made worse when you're jumping around or wearing cleats, or you are overusing your foot, or even have a growth spurt. For the young boy, the symptoms that began after starting soccer and that weren't even painful at all this summer long made me recognize it was a condition called Sever's disease. The technical name for this is calcaneal apophysitis. The calcaneus is the heel bone, and the area that's called an apophysis is where a tendon inserts into the growth plate into the back of the heel. This picture shows where the Achilles tendon inserts into the heel bone. It is best to squeeze the sides of the heel, and if it's painful, you can confirm the diagnosis. What did we do for treatment for this little boy? First, I had to modify his activity based on his pain level. Many children today go from one sport to another without taking any breaks. For the tightness of the Achilles tendon, I recommended a morning stretch with a belt or towel, 5 minutes of foam rolling to the calf twice a day, and a night splint to stretch the Achilles while resting. The patient will be also scheduled for physical therapy, and I also recommended an anti-inflammatory for a few weeks and icing to the area. I recommended something called a Thule's heel cushion in the cleats and custom orthotics for his normal shoes to offload the painful heel region. If you want to see the patient resources I sent him, I will include a link to my Sever's disease treatment process under this video with my Amazon recommendations. Now, what if he didn't get any treatment? The pain would continue, but as his growth plate closes, the pain would go away. Most kids that don't get treatment, they just stop their activity or sports, but that isn't a good option. I hope you found this helpful. If you did, please like the video and subscribe to my channel.